Everyone. Thank you for being here. If you'd like, we'd love it if you would drop your name and organization in the chat so we can see who's joining us. We'll just give people a few seconds to join and then get started. Come on, I see 39 participants. Drop your name, your organizations. We want to know who you are. I know there are friends here. Oh, look at all these people joining. Okay, people from the National Office of Change in Yakima. Okay, lots of folks. Wonderful to see people from all the coast, the middle of the country. Fantastic. Beautiful. Okay, I think we're going to get started. Welcome to everybody to this webinar. This is the next episode of the Next Generation Now conversation series. We're glad that you're with us today to discuss themes from our book, Next Generation Evidence. For those of you who don't know me, I'm Tamar Bauer, a co-editor of the book with Kelly Fitzsimmons and a senior advisor at Project Evident, whose mission is to harness the power of data and evidence to create stronger, more equitable impact. We believe evidence is power, and we work to build power where it matters most. Project Evident was launched in 2017 out of a sense of constructive dissatisfaction with the one study at a time approach, where funders and researchers drove research agendas on their own instead of collaborating with practitioners. Now we're a growing team of 35 across the country, and we've partnered with over 300 nonprofits, funders, researchers, and school districts to modernize, humanize, and scale how evidence is built and used. As some of you know, this project that the book grew out of traces its roots back to 2019 when we held a convening at Brookings, co-sponsored by the William T. Grant and Arnold Foundations. We gathered to discuss shared challenges and opportunities. As a result, we developed 5 principles of next generation evidence that are up on the screen. There's more detail on each of them in the book. And we wrote a book featuring short essays from over 80 authors that was published by Brookings in 2024. The 5 principles on the screen form the framework for the NextGen book and continue to guide our work to strengthen the evidence ecosystem. Today, I couldn't be more pleased to have 2 of our inspiring authors with us whose work exemplifies these principles in so many ways. I'm honored to be joined by Laurie Brotman, the founder of ParentCorps, and, this is a long one, Bezos Family Foundation Professor of Early Childhood Development, Director of the Center for Early Childhood Health and Development in the Department of Population Health at NYU Langone Health. And David Olds, founder of Nurse-Family Partnership, Professor of Pediatrics, University of Colorado Anschutz Medical Campus. Welcome to you both. We'd also love to hear from those of you who've dialed in. We'll have time for your questions, so please use the Q&A function at any time to drop your questions in. David and Laurie, an enormous personal thank you for your evidence leadership. I've learned so much from each of you, for your contributions to the book, and most important right now, for joining us today. I'd like to invite each of you to share a few words about what brought you to this work. Laurie, let's start with you, and then we'll go to David.
Great. Thanks, Tamar, and thank you to Project Evident for inviting me to this webinar. And I'm so pleased to be in conversation with you and with my friend, David Olds. So I'm going to start by telling you that what brought me to this work. I'll start by saying that I am a daughter of a CPA and a 2nd grade teacher. So one who is a logical and analytic thinker, and the other who is intuitive, relationship focused, and dedicated to the well-being of children and families. So I've always been interested in both research and practice in service of young children and families, with the most interesting work happening, in my opinion, at the intersection. My early research was with an existing evidence-based program for families of preschoolers, where we learned about the potential for a group-based parenting program to result in long-term health benefits for children. But we also found no impact on academic outcomes or school performance, which was not a surprise because we weren't working with teachers or schools. And we learned a lot from parents, what they shared with each other in our parenting program, about their lived experiences and the joys and challenges of parenting. So as we set out to bring this or a group-based parenting program to schools in historically disinvested neighborhoods for serving primarily children of color and focus on the school environment for students and families, we hit some roadblocks in terms of adapting and changing an already existing evidence-based program. And so we knew that we wanted to work with the information we were getting from teachers and students and families. And so after consulting with a number of prevention scientists who were also program developers, including David Olds, we set out on the journey to develop ParentCorps.
Thank you, Laurie. I didn't know all of that. That's wonderful. It's great to have an opportunity to learn. David, I know it's hard to keep it brief and that this is such wonderful information. Please share a little.
Thanks. I'm like Laurie. Thanks so much for inviting me. Appreciate the honor of being at the same table with Laurie and you tomorrow. You know, when I think back about my own interest in this work, it goes all the way back to my adolescence. When I was an adolescent, I decided that I wanted to do something about improving the lives of vulnerable children. I've seen pictures and stories about children in Africa and India. And I eventually went to undergraduate school in Baltimore and started out in international relations. I dropped out of that program and started studying developmental psychology. And I went to work in an inner city daycare center following my graduation in 1970. And you know, it was in West Baltimore, and I really hoped that I could improve the lives of the 4-year-olds in the center where I worked. And you know, we set about implementing the Perry preschool curriculum, for example. But I soon realized that for a lot of the children in my classroom, it was already too little and too late. One little boy, for example, couldn't sleep at nap time. And one day, another teacher and I took him down to another room and asked him, Jamie, how come you can't sleep? And he said, you know, when I sleep, I wet myself. And if I wet myself, my mom beats me. Another little boy in my classroom couldn't speak. And his motor coordination was compromised. Turns out that his biological mother was a drug addict and an alcoholic. The little boy had been abandoned to people in the drug trade. He was being cared for when he entered our center by a really heroic grandmother. And so I set up parent group meetings, but it was only the children of parents I was least concerned about who showed up for the parent group meetings. And so, and also the neighborhoods in which the families were living were terrible places to have to raise kids, to live no matter what. So I wrote to Laurie Brotman at Cornell, and he discussed it. That's the situation with him, and he wrote back, and I eventually went to Cornell to get a PhD with him as my mentor. And while writing my dissertation, I developed a proposal in Elmira, New York, to develop this program that we'll talk about in a moment, and to evaluate it in the form of a randomized clinical trial. That's my brief history. How I got into this.
Thank you, David.
Okay.
Now, just to ground this conversation and provide context for anybody who may not know, can you just share very briefly, just describe your program and the highest level impacts?
Okay. You want Laurie to go first? Laurie, you go.
You go first, David. David, go ahead.
Okay. All right. What we've developed and refined and tested over the years is a program of prenatal and infancy and toddler home visiting by nurses, primarily focused on very low-income mothers with no previous live births. And the program is grounded in theories of human attachment, human ecology, self-efficacy theory, developmental epidemiology. All of those general forces came together to focus our efforts in the program. And the nurses in this program have three major goals. The first is to help women improve their health-related behaviors that have a bearing on gestational development. Cutting down on cigarette smoking and alcohol use and drugs, minimizing toxic stress, and coordinating care with primary care providers in communities to make sure that their emerging health problems are identified and treated promptly. The second major goal is to improve the child's health and development by helping parents provide sensitive, responsive, growth-promoting care for the baby in the first 2 years of life. And the third is to help women improve their own health and life course, and economic self-sufficiency by working with mothers to think deeply about what matters most to them and to use that that relationship that's built on the foundation of 4 weekly visits to articulate what is most important to this mother. And that serves as the foundation for the program. The program has detailed visit by visit guidelines and is grounded in and hundreds of facilitators that are used to have sensitive conversations with mothers and other caregivers around things that are unique to their interests. So the program gets adapted to those interests. And so the key here is that the program is the frequency of contact and the content of contact is really adapted to the unique needs of each individual family.
Thank you so much. And I'm going to just move it to Laurie because Megan has kindly dropped in the chat resources about outcomes and the slide deck. And I think just in the interest of time, I'd like to do that. Okay?
Sure.
Okay, Laurie, about the model, and then the resources about the outcomes are detailed in the chat with the links. And thank you both for providing those.
Sure. So ParentCorps is an evidence-based program that partners with educators to reimagine family engagement and social emotional learning, building a more impactful early education experience that unlocks the full potential of early childhood education. So the ParentCorps model includes 3 synergistic components implemented in schools and community-based organizations with pre-K programs. The first is a group-based parenting program. The second is a classroom-based social emotional learning program. And the third is professional development for pre-K teachers, leaders, so that might be principals or directors of centers, and also mental health and other support staff. I can stop there because I'm not gonna, I can say a little bit about the existing evidence, but let me just say this, that we have evidence from 2 randomized controlled trials that you can read about in our publications in terms of mental health and academic achievement. And I asked you also to just go to our website, which is also posted here, to read the stories of families and educators and people that are facilitating the program, to hear some highlights, like other forms of evidence about the program, about how it's working, why it's working. So there's lots of fun sort of stories there.
Fantastic. Thank you, Laurie. Okay, now let's dig in to learn more about how these models have evolved and continue to evolve. I mean, to me, this is really fascinating. I love it. So let's jump into it. David, your case study addresses how you are developing a version of nurse-family partnership for mothers with previous live births, which are called multiparous births. Multiparous mothers, sorry. It's called NFP, Always a Work in Progress. Can I ask you can we start there? What does that title mean to you?
You know, over the nearly 50 years that I've been at this, I've realized that this is going to always be a work in progress. We're serving new families, different contexts, different cultures, different health and human service systems, and we don't get it right all the time. So we need to be paying attention to all of these things. Some of these things can be handled through continuous quality improvement and relying on an infrastructure and uh, 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 sort of evidence from program implementation about what's going well, what's not going well, where, why, and so forth. But also, there has been, in this particular case, um, interest in serving a big segment of the population that's in need. And that's where women who've had previous live births are in need. And many of the sites around the country implementing NFP want to serve that segment of the population. We don't have yet the kind of evidence that we really need to justify investing big resources in that segment of the population. But we've got some preliminary evidence that's encouraging, and I need to acknowledge, let me just say this, I need to acknowledge that this particular chapter was led by Dr. Mandy Allison, who's a pediatrician and who has taken over for the leadership of our center, the Prevention Research Center for Family and Child Health in the Department of Pediatrics at the University of Colorado. This is Mandy's passion. She's a practicing pediatrician. She knows about the challenges of moving evidence into practice. She thinks deeply about these issues. So you have to bear with me because I don't have the how should we say this, the in-depth knowledge that Mandy does about these very issues. This is her baby. But I know enough about these things that I might be able to speak about it at a high level. So the point, I suppose, is that um, this program is always going to be a work in progress, and we need to bring to the table the most appropriate sources of evidence to guide decision making going forward. And in this particular case, Mandy led a 31 site formative piece of work in sites from around the US that wanted to serve women with previous live births. And they dug into this deeply in terms of interviewing mothers, discussing this with various stakeholders to get a sense of what the challenges are, the needs are, the opportunities. One of the things that struck me most about this is that many of the mothers who'd had previous live births said, you know something, I want to get it right this time. They had a history of challenges in caring for their firstborn children. And that segment of the population was predisposed to take on the offers of support that were being offered by this program. That's very encouraging. It also is a little discouraging, not discouraging, I wouldn't say, but we need it. It's a source of a source of possible influence on outcomes that are not gathered through randomized clinical trials. And what I can tell you is that Mandy submitted a proposal to NIH that was funded to look at the impact of this modified program for women with previous live births. But there were some challenges with recruitment, and partly due to the availability of a number of other home visiting programs in the communities we had identified to serve this population. And then with the new administration, the study was canceled. And so it was back to using quasi-experimental designs to do an evaluation. And there's, how should we say this? There is an attitude about there's a real sense of need in the community. We don't have the same level of evidence in serving multips as we do primips or nulliparous women. We've now 8 randomized clinical trials conducted around the world showing effects, discerning the effects of the program for that segment of the population. And but the need is there. And we simply say to communities, look, we don't have that level of evidence, but if you feel that this is something that you want to invest in, we're with you and we're going to be doing our best to sort out what the potential benefits are in serving that segment of the population. And so there's a certain caution that's put out there. And to say, if you want this, we're ready. And one of the things that Mandy and her team did was to develop a whole set of what we call facilitators that are designed uniquely for this segment of the population. How do you deal with other children in the household? What are their needs? Um, and what kind of additional training do nurses who serve this segment of the population need in delivering this program for women with previous live births? All of that was thought about in a really deep way. So and that's all Mandy's contribution to this. Let me just say one other quick thing, Tamar, and that is that Mandy now, I think I might have said this earlier, but Mandy now directs the Prevention Research Center for Family and Child Health when I stepped down from that 2 years ago. Okay.
That's fantastic. That's fantastic. Let me ask you one more question, David. You write
Sure.
in the essay, you write that the practice and research worlds are sometimes seen as not compatible or being somehow misaligned. How do you think about this? And especially in the context of the MULTIPS work, is there any, is there a specific focus on integrating research and practice in that world?
Yes, and I think that we need to, first of all, we need to be generally attuned to that as an issue. We need to be respectful of various stakeholders' challenges in implementing these programs. And that means we need to inquire about how it's going. We need to use both quantitative and qualitative data to inform our decision making. We need to, and in some cases, often it's just a matter of making some adjustments in kind of a quality improvement framework. But in others, it requires a deeper dive. And when you do a deeper dive, we need to do things like more systematic formative development of variations in the way the program is delivered to have greater certainty that something that comes out of the academic world is going to be actually implemented, because people will say, oh yeah, well that aligns with the challenges that I'm experiencing. So it's that kind of thinking that I think is so critical in bridging, the randomized clinical trial and what actually happens in the field. So that's a major challenge for all of us, I think. And thank you, Tamar and Project Evident, for making this such a focus of your work.
Our pleasure. Kind of you.
Yeah.
Laurie, let's turn to you. In your case study, which is titled A Collaborative Evidence Building Strategy Guided by Family Voice, you delve into the work that you and your team did in partnership with the New York City Department of Education, Division of Early Childhood Ed, beginning in 2015. Then in March 2020, when COVID-19 hit, you wrote, seemingly overnight, amid tremendous uncertainty and fear, we worked to take ParentCorps programs and evidence building virtual. Can you tell us about this pivot and how it leveraged existing skills and infrastructure ParentCorps had built for ongoing learning, what you also describe as years of building muscle around collaborative evidence building?
Great. So let me set the stage for what this work looked like back in 2016. So we had won a multi-year services contract from the Department of Education to scale ParentCorps across New York City pre-K programs. So the contract was with the largest school district in the country, right, serving over 1 million students a year, and was in support of advancing the quality of universal pre-K, which was rolled out just a few years before and serving at the time 70,000 pre-K students annually. The funding was available through the mayor's office, and this was part of his citywide initiative to improve mental health. So it was the same mayor that bet on universal pre-K as sort of his signature initiative, and then a second initiative that overall didn't go as well was to improve the mental health of New Yorkers citywide. So the priority of the mayor's office and the Department of Education was to provide quality pre-K programs to support families of pre-K students and to support mental health. They committed more than $18 million to these efforts based in part on our previous research and also on our strong, very positive reputation in the city with regard to partnering with schools and families and providing high quality, culturally responsive programming. So here's a situation where there was a big investment based on our evidence or their read of our evidence and our reputation for practice and for partnership. So they asked us to support 50 plus pre-K programs in schools and in early childhood centers to offer our parenting program to all families of pre-K students in those programs and our social emotional learning program to all pre-K classrooms over a 3-year period. And what I didn't say in our evidence to date, all of our evidence was in schools with pre-K programs. They look very different than centers, community-based organizations with centers, maybe Head Start programs or other kind of pre-K programs for children. But they asked us to, this is who they served and where they served the kids, and they asked us to serve them there. They also asked us to provide our professional development component only as a standalone intervention to all pre-K teachers and leaders, principals and directors in 300 pre-K programs also over this 3-year period. So in this case, we were responding to the mayor's office and the Department of Education, and their questions were really about how can they support children and families and educators system-wide. So to do that work, and this is a little bit about like what infrastructure we built just to do the services work, right? I would say the infrastructure that we built was about building relationships, communications processes, and an evidence building strategy to meet those specific goals. So at the same time, we had critical questions about the impact of the ParentCorps program, the 3 components all together, when delivered at scale. We had worked in 10 schools at a time in our trials, and here they were asking us to deliver the program to 50 different programs at the same time, delivered by their own staff, their own mental health professionals working in the schools with a more diverse population. So our original trials were mostly with Black families, and the population here was much more diverse, Black and Latinx, as well as from other racial and cultural groups. And in pre-K programs in schools and in centers. So we had a lot of questions about, would this work? In addition, we had major questions about the value of the ParentCorps professional development program alone as a standalone. We knew people liked it. We knew they said it was better than anything other professional development they've ever had, and it was very unique. And so there was like a consumer interest. But we had no idea. We had no evidence to say, rigorous evidence about causality, right? To say like, this is going to work to do X, Y, and Z. And not only that, but is it better or different? Does it lead to better or different outcomes than the professional development that they were providing across the city already to teachers? So here our questions were very specifically about whether or not the ParentCorps program model worked at scale and whether this, specific component worked on its own. And so for those questions, we worked with multiple teams across the Department of Education, including program quality, but also their assessment teams, research sports teams, IRB, et cetera, to design and carry out 3 randomized controlled trials. And so the infrastructure, I would say the most important parts about the infrastructure for that piece of the research was the same as with services. So we built relationships, we focused on communication processes and evidence building strategies aligned with these goals. So that brings us to March 2020. So by that time, and I have to say, reflecting on like this experience of COVID, the COVID pandemic in New York City has brought up a lot for me as I think about this, and especially today, then I think about like on September 11th. So the history of doing this work in New York City is really resonating with me. I think especially today, as it does with all of our teams doing this work. So we had 4 years of experience in partnership doing the services, the evidence building, and these randomized controlled trials. And then as the COVID pandemic hit, we had to pivot in many different ways. And so one of those ways was about services, right? And so I remember very vividly that we were in February preparing for the 3rd of 4 professional development days in the city for that school year. And these were like putting on like weddings and bat mitzvahs, all things like celebrations combined for like hundreds of people. So we worked in partnership with the Department of Education and every sort of body available on our team to run live, in person, a very experiential professional development, which was different than anything anyone had ever experienced before, because we had small groups of 10 to 20 teachers working together with the same facilitator, the same cohorts over actually a 2-year period. And so we were getting ready to do another professional development day with hundreds of teachers across every borough of New York City. And so as we were approaching, and there was conversations from the DOE and from our own NYU health system about not gathering in groups in person of more than, there was somehow like a cutoff of like 10 and then 6. And, our plans for this day melted away. And so within like a few weeks' time, which I still can't believe that we did this, we managed to move the entire experience to virtual. So that's just one pivot. On the parenting programs, at the time when schools closed and schooling went virtual, from one day to the next, we were supporting 54 pre-K programs to offer these 12-session parenting programs. And so at that time of year, most of the programs were not even like halfway through. So there were these groups of families that have been coming together, building relationships, learning from each other, really invested. And the facilitators were invested in the families. And all of a sudden, that went away. And so we worked very deeply with the social workers who were facilitating the programs to consider the needs of families, to consider what was going on, to try to support them through this period. And some actually managed to stay with those groups of families and move those parenting programs online, like almost in real time, which was sort of also a miracle, but it was not the norm. But by the next year, a few months later, when school was back in session, hybrid, we had developed a new 4-session parenting through the pandemic program and a model for social workers throughout the city to deliver this program virtually to all families across the New York City pre-K initiative, which was 70,000 programs. So anybody who wanted to join. So those were a few services pivots, and I'll just say quickly that our RCT pivots involved first giving up many things that we had worked really, really hard to set up, like collecting data from teachers about kids' mental health and academic outcomes, and doing direct assessments in schools with children. So just out. So we had to not only give that up, sort of physically, but had to do a lot of emotional work to give that up for these trials that we worked really hard on. But fortunately, for 2 of the trials, we were in the midst of conducting telephone interviews with families. And so that had a chance of continuing. And because we had worked really hard at how we, on our communication processes and on how we talked with parents and how we listened to parents, even in conducting interviews, we were able to continue those throughout that year and beyond, really continuing to get incredibly valuable information, not only for our trials to understand how parents, the outcomes, but also hearing parents' voices and what they needed and giving that information back to our school district partners who were not in communication with families. And so, so for all of those pivots, I would say, we again relied on our relationships, our communication processes, and our very diverse and flexible and responsive evidence building strategies and methods.
Wow, that's a great story. Thank you for going into that level of detail. We'll come back and talk a little more after about some other questions. David, I'm going to jump to you to ask you to look back and look forward a little bit about the research results and what's up next for Nurse-Family Partnership. First, looking back, any unexpected research results in recent years that you want to talk about?
Yeah, I just want to say that we conducted 3 foundational trials of NFP here in the US, different populations, different contexts, and so forth, before we made the program available for public investment. And like Laurie, we set up, careful, a kind of what we call core model elements to have some assurance that the program would be delivered in accordance with the model that we had developed and tested. And that included building in an information system to monitor program implementation. All of that was done, and then we got invitations for developing the program in other countries, and we tried to create a foundation so that those other countries would invest in their own randomized clinical trials. And in general, the benefits of the program have been replicated across those trials, with one exception. There's been a very large, nearly 6,000 participant randomized trial conducted in South Carolina with families who qualified for Medicaid in, say, 2018. Medicaid eligibility had risen since we began this work in, back in the 70s and early 80s. And so it was 100 of the Medicaid, and the national office geared eligibility based on Medicaid eligibility. And I had hoped that even though the program was serving less vulnerable families, with a large sample, we would be able to discern the added value of this program for those with fewer needs. But turns out that 42% of those enrolled in the South Carolina trial were either college graduates or in college at registration. And that compares to our Memphis trial, where the mean educational level was 10th grade for women, and who 98% were unmarried. 85% were living below the US federal poverty guidelines. So the samples are dramatically different. And the method of gathering data on and recruiting participants was also dramatically different in South Carolina, where it was very impersonal. Called people up on the phone who were qualifying for Medicaid and said, "You want to participate in this study," compared to Memphis, where NFP nurses sat in the primary care prenatal OB clinic and interviewed women in an empathic, respectful, caring way. And 47% of those invited in the South Carolina trial enrolled. 89% of those in the Memphis trial enrolled. Big differences. And who do you think declined? Those who were most distrustful. I don't know that for sure, but I suspect most distrustful of those doctors and nurses and people who want to pry into my life. So the effects, when they tested the effects on pregnancy outcomes and child health and development, were zilch, nothing. And the that's highly informative. It's really informative. But I'm reassured by the results of other randomized clinical trials conducted around the world that focused on those with overlapping sociodemographic needs and those with personal challenges that would make it more likely that they would have room for improvement. And so I see it's a major piece of learning. And for me, it says that we need to figure out better how to actively work in community context to devise methods of reaching those who have greater needs at the stage of referral into the program. And I'm also encouraged, I suppose, by a recent study that was published by investigators from CDC that indicated that children growing up under profoundly adverse circumstances, that applies to your group, your families, Laurie, and our families, the estimates of cost savings over the life course for those families, the US spends, according to the CDC report, $14.1 trillion per year on years of life lost, chronic disability, healthcare off the charts, healthcare costs in serving those families. And we've got all of the other kinds of dysregulations that come from children growing up in those conditions, and the mothers too, without adequate support. So for me, it gives me reason to say we got to continue to dig into this. We can make a difference, I hope, and save society a ton of money. And we're in the midst right now of conducting a 30-year follow-up of our Memphis trial, where the needs are so great. And we will be looking at everything from maternal and child mortality to the development of chronic disease. And stay tuned. We'll have more to report on this in the next year or so. We're in our final year.
Fantastic. Thank you, David. Both of you have expertise with a wide range of research methods, and you've both referred to them. Laurie, just a few words. How do you think about the question of which research methods to use when? Any guidance for people on the call?
Sure. So what I tried to lay out already is really focusing on the question. What is the question? I think the first thing to do is to pay attention to who's asking the question. whose question is it, right? Is it a question of scientists? Is it a question of the system leaders? Is it a question of the community? I think we need to do a lot better at paying attention to the questions that are coming from community, and also systems. I think we have to spend a lot more time talking about systems, and systems change. And then depending on what the question is, so if the question is really, does this work? Is it worth an investment? Like, does it work at all? And also, does it work relative to something else, right? So ParentCorps works as an enhancement to pre-K relative to pre-K, right? Which has its own benefits. So really understanding, like, what are you asking about? We had the question of, does ParentCorps professional development alone work, right? And so we had no evidence one way or the other. So we had to set that up in an experimental way to say, like, so we could conclude, yes, it works relative to this to do X, Y, and Z. And I'll just sneak in that we now have substantial evidence from 2 randomized controlled trials, one in schools and one in centers, that ParentCorps professional development as a standalone intervention relative to the Department of Education's very high quality professional development leads to significant differences in family school connections, importantly, as measured by parent perceptions of the school environment as inclusive, and on parents' trust in teachers and in leaders. So we're really excited about those outcomes. And, you know, that was important for us to have an evidence building strategy that was about, does it work? But we also did a lot more evidence building to understand, how is it working? For whom is it working, right? And mostly listening to the voices of the participants, whether they're parents or teachers or systems leaders, or community members. And so, you know, it's really, who's asking the question? What is the question? And really thinking about a whole range of evidence building strategies to answer those questions.
Perfect. Thank you so much. Now, we're going to take questions from the participants. So people drop your questions in if you have any. Otherwise, we'll keep going. We have lots of things to talk about, but I just giving you a heads up.
Tamara, well, before you go on, I just want to say I'm with Laurie.
Sorry, David. Yes. Okay.
Yeah. So brilliant answer, Laurie. I agree with you completely.
Thank you. Okay, so now, just before we take questions, can you identify, each of you identify one, what I would call actionable step related to the work we've talked about today that you're passionate about, but which you believe is too often overlooked by either funders or researchers or practitioners, something you just really wish people would get? Whoever wants to go first. David.
No, yeah, I think that there's a lot of focus these days, at least in my world, on having nurses who are trained in a particular way. But I happen to believe strongly that the most important aspect of all of this is the nurse's capacity for building relationships. And that means fundamentally being a caring person, being a respectful person, being empathic. Though that kind of interpersonal dynamic is foundational. And without it, no matter what kind of training you have, this program won't work. You've got to have that capacity for empathy, caring. And so I hope there's a way we can engender that in the work we do. And my guess is that it may apply to Laurie's work as well. So I see, I think it looks like tomorrow's frozen, Laurie, but you're moving. So
Yeah, I'll go next. She's frozen my screen too. Yeah, I totally agree with you, David. And I'll add that I think for funders, that I think we need a very different approach. Oh, we've lost Tamar. To funding partnerships, into thinking about partnerships and funding partnerships. So, I tried to underscore the important work that our very large team of practitioners and researchers and people who wear both hats were doing over many years to build the infrastructure, right, for this kind of uh, work. And the infrastructure is really about relationships and communication processes, right? And decision making based on priorities, but also on values. And so I think there's really a lack of recognition across the field in how important that is and how much it costs and how much time and investment it takes to actually build those partnerships.
May I just reflect on what you just said, Laurie? And that is that I agree completely with that. And the way I've been thinking about this same issue is that none of us has the answers to do this on their own. That it really requires deep teamwork, respectful teamwork across stakeholders, representatives from different sectors within communities. So it only gets done if you have effective, respectful teamwork. So I'm totally with you again on what you just said.
And Megan.
Hi, everybody. In the absence of Tamar, I thought I would hop in. And here she is. But I was just going to ask, someone sent me a separate note asking if there's any insights from practice that have changed over the course of research. Either of you want to take that on?
Among the things that has struck me, of course, is I guess the related issue for me is that, and I've already said this, but that this NFP is not a program for everyone, in spite of the fact that all of the nurses in our original trial said, oh, boy, I wish I had this program when I was pregnant and parenting for my children. And we hear that over and over again, but the benefits are most pronounced where the needs are greatest. And we just need to keep that in mind. And the other piece, of course, is that it really takes caring, respectful individuals. So I've been told that I repeat myself a little bit, so I'll keep quiet now.
I'm not sure what I missed, but I'm just going to jump in and say I've lost all the chat. So if there are questions from the field, please bring them up. But in the meantime, I would love to know what's next for both organizations. I feel like that would be a good way, unless there are questions that are pending that I can't see. And apologies to everybody, my internet just went off.
Let me just say this, Tamar.
Sure.
We created a U.S. national nonprofit to replicate the program here in the United States, and that my direct role in that is limited.
Yep.
And so that national nonprofit has recently undergone a name change and a reorganization. It's now Changent, and they've embraced another evidence-based program, Child First, to address the needs of really vulnerable families that are on the where the nurses don't have the level of enough time to really dig into this with them. So that's
Yeah.
among the things happening.
I'm just going to follow up with the question that did just come in because I think it's important. You spoke about the importance of finding the right nurses who have this empathetic relationship building capacity. There's a question about, do you have any particular ideas about how to find the right nurses? And I was thinking the same thing as you spoke about it. That's a hard hire.
Well, let me just say this then. When that's been a foundational principle for the program since the Elmira trial. We put the nurses who applied for this job through a rigorous process where they were given open-ended case scenarios. And we asked them as part of their interview process, and we asked nurses to reflect on these ambiguous situations, and we systematically coded their responses to these open-ended cases and sorted out those who took these difficult situations and were judgmental. And I have one nurse, Diane Farr, said to me early on, I'm a nurse and I'm used to walking into a place and say, I see you got a job opening here. I'd like to apply for it. And she said, well, um, can you start this afternoon at 4 o'clock? So it's that kind of thing. She said, I've never been through this kind of process. Now we turned over to the US National Office a whole set of questions to ask of nurses to in the interview process to have some assurance that we are getting the very right person who has that strong set of interpersonal skills for this job. So the
Yeah.
US National Office has a copy of that procedure now.
Yeah. Thank you. I think people are really, paying attention to that, and it's great that this question came in. It's a tough job to figure out, to find these people.
You want me to
Laurie,
go? What's next?
yeah, what's next? Yeah.
Yeah. So we currently have a national office for ParentCorps that's housed still in at NYU Langone. So researchers and the practitioners are all in the same place. And it's led beautifully by Kayama Hamer, who has been director for a little over maybe 2.5 years now. And we have an ambitious national scale plan, a growth plan that really does lean into these new findings for the value of professional development alone. And so we are scaling both the full model and the full program to pre-K programs in a number of cities across the country, and also really offering our professional development, which seems to be not only effective, but really unique in this in the current space. And so on the research side, we did manage to make some lemonade out of the COVID lemons. And so we gave up a lot in our trials, but we managed to continue the trials based especially on the data that we could collect from families and also administrative data. And so we've built on those data, and we actually applied for 2 R01s, which are following children and families and over time. And one was specifically looking at the impact of ParentCorps delivered before the pandemic, and whether those impacts from ParentCorps professional development alone and also from the full model and the program are sustained throughout the COVID years and over time.
Okay, on that note, that's exciting. And on that note, we're at time. So I just want to extend my deepest gratitude to David and to Laurie for sharing so much with us, and invite all of you to fill out a quick couple of questions survey that Megan has just posted. Next conversations that are coming up in the next 2 months will feature Heather King with Veronica Olazabal, Nisha Patel with Ryan Martin, and Kelly Fitzsimmons with Pete York. Hope to see you again. And thanks to all of you for joining. It was a great conversation. Take care all.
Thanks, Tamar.
Bye.